Welcome back, everyone. Austin and Travis County have a new guide to help navigate and address some of the more pressing public health challenges for our community.
Some of those obstacles include mental health distress, overdose deaths, and gaps in access to necessary health care. These are all laid out in the latest Community Health Assessment that's released by Austin Public Health. And here to talk through that assessment is Kodjo Dodo, a public health program manager with APH. So thank you so much for being here and for diving into this assessment with us.
Thank you for having me.
We appreciate it. We really want to start by just explaining why this assessment is helpful and what does it do for the effort to try to find solutions to improve public health here in Austin.
Avery, thank you so very much for your question. A CHA, which is Community Health Assessment, is very important for various reasons. One, it helps inform our policy makers, develop policies, allocate resources, and also help identify health needs and disparities. So that's why community health assessment is so important.
One of the findings from this that really jumped out at us is that there was mental health distress and it being widespread in Austin and Travis County. Where is that most pronounced according to the analysis from this report?
Yes, it's pronounced, as you know, coming out from COVID, people were under stress for different reasons: economic distress, housing instability, food insecurity, and all those issues can accumulate and over time can lead to some mental health that we are seeing.
We also will note that the report found substance use and overdose deaths are declining in our area, which I know is a welcome statistic there, but I'm sure there are still challenges with those two issues that need to be addressed. Talk about that a little bit for us.
Yeah, mental health and overdose, sometimes they are interrelated. So when mental health goes up, it's more likely people who might be impacted may be using some substances. And when we are talking about substance overdose, it's not unique or peculiar to Austin. It's a nationwide issue. And as you know, in Texas in particular, we are struggling, people are struggling in finding healthcare providers. So yeah, you are having mental health. If you don't have providers, your issue will linger for a while. Maybe, although it might be declining, but we are still seeing a lot of many people suffering from mental health and overdose issues.
Yeah.
And important to note too that some of these things are all interrelated. They can impact one another.
Absolutely.
Yeah, we also want to touch on that it's perhaps unsurprising, especially given the things that have happened this year in particular, that instability with both food and housing remain persistent problems here in our area. So how important do you think that is for local leaders to see that reflected and echoed in this report?
It's very important for policymakers and our elected officials to take note and to plan accordingly. Because if you are facing housing instability, yeah, you might not have a place to cook food, even though you are a good cook.
Yeah.
So you need a safe place to live in order to find a good job and to work and to provide for the family. So housing stability is very critical in dealing with other issues.
Was there anything in this year's assessment that gives you hope, even though it's identifying challenges for the community? What jumped out as kind of a way forward for Austin Public Health?
For Austin Public Health, as you know, those challenges are enormous. And it will be difficult for Austin Public Health alone to try to address all of them. So right now, before we publish our Community Health Assessment report, we are working with our partner organizations. Right now we have about 11 partner organizations, and they are trying to address similar issues. So in partnership with our partners and other nonprofit organizations, we will develop in months to come what we call community health implementation plan to address all those needs. And again, we might not have all the means to address them, but we establish maybe work group, work with nonprofit organizations, other partners to address all those needs.
Well,
it might not be quick, but we are working on.
Yeah, there's at least progress happening there too.
Correct.
Well, Kodjo Dodo, we appreciate you coming in and talking more about this, and perhaps we'll have another conversation about some of those implementation plans that are still to come. So thank you again for being with us.
Thank you for having me, sir.